First of all, I just really want to say sincerely thank you so much for having me. I've met a bunch of you last night, a few more this morning. I'll be around for lunch today if anybody wants to have a chat, bend my ear about the podcast that I work on. And those of you who don't know the podcast, get amongst it. Seriously. It's called Ladies We Need to Talk. It's fortnightly. It's produced by ABC via their science wing, so it's thoroughly researched. So far, we've not made one factual error. 3 years of seasons. We're extremely proud of the work. And I know as rural health practitioners, a lot of you spend time in the car driving. It's a perfect 23-minute long podcast where you can get a dose of Ladies We Need to Talk. One of the other reasons I'm super excited and proud to be here today is because I grew up in country Victoria and I understand inherently the problems that you can face, the challenges, and of course some of the fantastic advantages of living in the country. I was in Swan Hill from the age of 0 till 14, and that's like proper country, I reckon. I call myself a broadcaster. I'm on the radio from 3 till 4, Wednesday to Friday on the KISS network nationally, giving me a huge audience of people, generally parents, and by parents I mean mums, picking up their kids on the school pickup from 3 till 4 p.m. As well as that, I've just released a book called Welcome to Your Period, which is a guidebook for 11, sort of 9 to 12-year-olds, setting out how to manage the menstrual cycle as a kid yourself. It's been out for 3 weeks. It's a bestseller, so I'm super proud of that. As I mentioned, I'll be around for lunch if you want to just hang. I'll also give you an opportunity if you do want to record a message for the podcast, Ladies We Need to Talk. My phone's got great audio capabilities and you can record something into that phone if you want to. But at the end of this particular session, we'll be taking about 10 to 15 minutes of questions. So if there's a question that you'd like to ask in front of the room, tuck it away, maybe jot it down so you don't forget when you get nervous and stand up. And we'd love to take your questions at the end of the session. Let me introduce you though to our panel. To my left immediately is Charlie, 20 years old, young trans man from Shepparton who came out as trans at 14 and gay at 17, 18. Next is Mia, who had an unplanned pregnancy at the age of 16 from my hometown of Swan Hill, but didn't know about it for 6 months. We'll find out how that turned out in a sec. Amal is next to Mia, 42 years old from Shepparton, came from Sudan and knows firsthand about female genital mutilation and what its health implications are and what dealing with that in the country can mean. Kath, HIV positive, an activist from Mount Beauty and somebody absolutely fearless in her self-advocacy. We'll hear a lot more about that in a sec. And Tadek from Ballarat, our youngest panel member, 16 years old, autistic with ADHD and a trans boy. Please make our panel welcome. With so many important and interesting stories, it's going to be really hard to choose who to go to first, but you're nearest, Charlie. So I'll start with you. Tell us about the first time that you and your mum went to your GP to discuss transitioning.
So I was about 14 when I first started transitioning, and my first ever experience was telling my family GP, so my family GP had been from the age of 0 up until 14 when I started transitioning. And he had no idea what to say, and he basically turned around and told me that I was insane, that I needed to go and see a psychiatrist after I told him that I felt like a male and that I wanted to transition, because I'd done my research myself. I'd jumped on Google and done all the, Googled everything. And he told me that I was basically psychotic, that I needed to see a psychiatrist, and that what I was doing was wrong, in a sense. So that was my very first medical experience. So trying to seek out services for being trans and basically being told that I was psychotic and that I needed to see a psychiatrist. So
at the age of 14, it's an extremely vulnerable time at the best of times.
Yeah.
Your mum was with you at the time, and I think we're going to hear a lot more about advocacy. How was she as an advocate?
She was amazing. So my mum has been my biggest support throughout everything. So when I came out as trans, she really didn't know what being trans meant. So as much as it was a learning experience for me, it was also a learning experience for her. And she did the same. She jumped on Google, and there is a group in Shepparton where I'm from, and it's called PFLAG, and it's basically parents of LGBTQ plus parents. And so she reached out to a few members who also have trans kids, and she got some information. So yeah, she's been my biggest advocate.
Mia, I want to go to you next. Talk us through what happened when you were 16.
So when I was 16, I unfortunately had to go off the pill because I was getting migraines that were onset by the hormones in the pill. So
you were already sexually active at 16?
Yeah, I had a boyfriend, who I'm still with today. So Mum and I went into the GP to see if there were any other options of contraception for me, because obviously we know what happens when you don't use contraception. So the GP basically said, you know, given your family history, because Mum has the same problems, she said there's not really much you can have in way of pills or the rod or anything like that. And because I hadn't had children yet, she said that I couldn't have the Mirena. So it was a very awkward and uncomfortable appointment. Even though she was our family GP, like her face was, you know, thinking, oh, you're only 16 years old and you're coming here to me about that. So she just kind of piled up some brochures and was like, yep, there's not much you can do, but just have a read of it anyway and, you know, go home. And unfortunately didn't offer me a pregnancy test or, you know, anything to do with STIs or anything like that. And then cue pregnancy.
So you were actually pregnant at that appointment?
I would say I 98% would have been, and if not, it would have been a couple of days to a week later, because when I'd gone off the pill, I'd had my period for a month straight, and then as soon as my period had stopped, we made an appointment to go get some contraception, but yeah. Yeah,
right. Do you think that, so I have such a clear image of her stacking up some pamphlets, and it's almost like, here's my sense of responsibility, I'm giving it to you and walking away. Do you think that had anything to do with the fact that you were in a rural setting?
Definitely, because, you know, in most rural places, but especially in Swan Hill, we don't talk about sex, we don't talk about young people having sex. And it's really funny because the Mallee has the highest rates of teenage pregnancy in the state. So it's really funny that I went to a GP to kind of prevent that from happening, and she wasn't proactive at all.
That misconception about a Mirena not working or not being able to be inserted if you haven't had a vaginal delivery, that's not true.
No, it's not. But and I found that out afterwards, only a couple of months ago, through some of the work that I've been doing. And, you know, you don't question doctors. Like, why would Mum and I go there and get told that and think, oh no, that's not true? Like, you kind of take it as, you know, gospel when they tell you that. Yeah.
Totally. So what ended up happening?
So about 6 months, there was a little while where I was, you know, kind of feeling like, oh, I think I can feel some kicks and stuff inside. But I was very tiny when I was in high school, very skinny. So I'm thinking, oh, you know, I couldn't be pregnant. I don't look pregnant. But then, Mum kind of pulled me aside one afternoon and said, you know, you look like you're putting on a bit of weight, which is fine. I think you're beautiful, but you haven't had your period in a while, and you know you're not having the pill. So I think we need to do a test. But I already knew what it would say. So yeah, I was pregnant.
God. All right, we're going to dig deeper into what that experience was like, but I want to get to Amal. Amal, you arrived from Sudan in 2005. 3 of your children were born in Sudan or overseas, and 3 were born here in Australia. Tell us how doctors reacted to your experience of FGM.
The first baby I born here in Royal Hospital Women, and when we come, they don't know everything about FGM. And when I'm delivering the baby, everyone is scared. They said, what that happened and why they do that. And they bring down Egyptian doctor, and she explained that, and she said, yeah, that one is happening in our country too, in Egypt and in Sudan too. That one, when you're not done that, you can't marry. They said, when you not do the FGM, you never can you marry anyone because that is the rule in my country.
So there was fear, was a reaction from the health practitioners helping you deliver your babies.
Yeah,
How did that make you feel, Amal?
it's bad.
Yeah, because you're already so vulnerable, being so pregnant and having the baby, and then feeling like a sense of shame. So since then you had 2 more babies. Was there a difference in how you were treated after that?
Yeah, different.
Tell us what was the difference?
In my country, when you get the baby, they sorry, they stitch you again, and they make you to come back the first time. And here in Australia, is no, just the cut and give you milk. And this is what is coming easy for me when I get the 2 child here.
Right, so the subsequent children, the births were easier.
Yeah.
Amal, I want to come back to talk about your experience of periods and bleeding, but let's go to Kath now. Kath's from Mount Beauty. So you're born and raised in Melbourne, but reverted well, not reverted, but you went to the place where your childhood holidays were to live. How did you contract HIV and how was the diagnosis?
Okay, I contracted HIV in a heterosexual relationship. We'd been having condomless sex from the start of the relationship, having had the conversation around HIV. I'm latex intolerant, and so when I first started having sex, as over 30 years ago, there wasn't any alternatives. And if they were starting to develop them, very hard to get a hold of them, and I'm working in the snowfields, so I learnt to just get a sexual health checkup at the end of every season, at the end of every relationship. So I knew going into that relationship that I was HIV negative, and as I said, we'd been having unprotected sex for the probably 7-8 months, and he went that way one time and I went the other, and I've gone, oh, that hurt, and I was bleeding from the vagina. So I had semen that was infected with HIV directly into the bloodstream. Prior to that, I'd been having sex with someone HIV positive, and because there was no trauma to the vaginal wall, no transference. So it is harder for women to contract it vaginally, which is all good to know. So within that event, after that event, within 2 weeks, I was what is known as zero converting, where my immune system was in the fight of its life. And my eyes were telling me something was going wrong. And I was at the doctor saying, there's something wrong. My eyes feel like they're going to explode out of my head. We didn't test for HIV. By then it's too late anyway. If I had have known he was positive, I had 72 hours to take medication to stop myself from zero converting. I said, is it glandular then, my glands are up, all this sort of stuff. Probably about, it was only 8 months later, through the screening of a blood donation, that I was diagnosed with HIV, so I didn't get any pre-test counselling. It was an experience I wouldn't want anyone to go through, where you're in the reception of the blood bank and they come in, a phlebotomist with a tray full of test tubes and a doctor in a lab coat, and they take you off to a secret room. And so I'm sitting next to this, it's like a doctor's surgery where you sit next to where the doctor is at his table, and there's the lady in her lab coat and the phlebotomist is over in the corner. And I'm thinking, shit. I'd had a letter sent to my PO box, and it was sealed over and signed, and it said, you have a bloodborne virus, we need you to get in contact with us. It was in another envelope, sealed over and signed, and as I said, in my PO box. So by the time they'd rang them, had been a week since that they had issued the letter, and they said to me, why did you take so long? And I said, well, I've got a PO box, I work away, The night I got it, it was a Thursday night, and I am on the phone to the ex, surely not, because he's an ex by then, and my best friend, surely not. But the next morning, I knew by the setup. And so we're in the room, and the doctor started talking to, or the, I don't know, researcher, head of the lab, I wouldn't know, started talking to me about bloodborne viruses. An Asian lady with a bit of an affected English speaking, and I just said to her, I've got HIV, haven't I? And she said, yep. And I looked over in the corner and the phlebotomist is crying. Oh. This is my recollection, okay? So, very traumatic thing to have received. And I looked over and I do swear, by the way, and I am going to swear. And apparently that's a sign of honesty. I just said, what the fuck are you crying for? I've just been diagnosed with HIV. They then said, we need to deliver you to the infectious diseases clinic at the Alfred. So we're going to lock your car up.
What?
We're going to put your car in a locked facility overnight, and we're going to drive you over there. So I'm being delivered to the infectious diseases clinic, and I'm thinking, this is great, isn't it? Anyway, and they gave me a cab voucher to come back and pick up my car and all that sort of stuff. And in the end, I got a lift back, and I gave them the cab voucher back, and I think I wrote them a letter, and I said, you guys need to improve that process. that was very traumatic.
So, Kat, did that happen in the country? Was that?
No, that was Melbourne.
That was Melbourne.
So I was living in Melbourne, born and bred in Melbourne, went to a very good school in Melbourne, grew up in the outer eastern suburbs. I've lived a charmed life, but grew up holidaying in the valley across from where I am now every summer. My first job was as a ski instructor at Mount Hotham, and then I started taking trail rides out on the high plains with a lady by the name of Helen Packer, if anyone knows her. She's just passed away. God rest her soul. And so I decided when I was diagnosed, oh my God, how am I going to deal with this? You've had depression since you're 14, you're just managing to keep your shit together. You were asking to die, the universe to kill you because your life wasn't happening. Now the universe has said, I'll give you something that'll make you get up and live. And I thought, okay, so how am I going to cope with this? What makes me happy? Horse riding, snow skiing. Not even thinking about the implications of how am I going to access services. I just want to live healthy. And I moved up there, and you know, the barriers and challenges that I faced as someone who knows how to navigate the medical system have been astronomical. So for anyone who doesn't, it being from a cold background or you know, transgender, which is new, and the GPs are going, what? You know, it's a challenge. It's a challenge if you don't fall into this box that the GPs normally.
Part of your, I think, your drive, your reason to be here is because you're a queer and disability advocate. Yeah. And I love that. You're a really strong supporter of sexual health education reform. Yeah. Can you tell us, I think everyone in this room is so curious about what people learn at school about sex ed. And for many of us, it's, you know, it's 20 or 30 or more years in the past. Some of us have children who withhold that information from us, much as we try and milk it out of them. But for you, it's really quite fresh. So we'd love to hear about your experience of sex ed at school.
Well, when I got asked to come here the first time, I went around and had like the world's most awkward day at school because I just asked everyone I ran into what their sex ed was like. Because I go to Ballarat Clarendon College. It's half boarding, half day students. I'm a day student, but half our boarding students come from either Hong Kong, Japan, or like Swan Hill and Horsham. So very different places. By the way, my mum's right over here, so we're quite an open family. So I've had pretty good sex ed in my own time from the internet. But everyone from Swan Hill and Horsham got abstinence only. Or, yeah.
Mia's nodding. So you learn about abstinence as a form of
So I was quite, well, not lucky, but I actually started a couple of years at the Catholic school in Swan Hill for my high schooling,
Yeah, it was
and then
Catholic
I
school.
went over to the public school, but certainly at the Catholic school, and what I've heard from people who still go to school there now, yeah, they don't really talk about sex. The sex education is very minimal there.
So Tadek, when you said your friends got abstinence only, that wasn't in conjunction with other education about sex. That was it.
This is my friend specifically. She's come from Swan Hill to do boarding here. And she was like, I went to the Catholic primary school there, got abstinence only. The friend who went to Horsham, or lives in Horsham, got no sex education at all. That was true for 3 of my other friends. Because I realised after asking them that there's no program to make sure that students are actually getting a sex education. Because what happened was this particular friend and the others changed schools the year their school did sex ed and the year after my school did. So
it fell in the crack.
Yeah. And no one ever asked them, do you know what a dick is? No one asked them that. There was no information there. And there was nothing about disability for me. There's barely anything about queer people. And I was in an all-girls stream when I was in middle school learning about sex ed, which you think would be better somehow, but was somehow worse than I expected it would be.
Why is that?
Well, because girls have a thing about, or the girls where I was living, in outer Melbourne, had a thing about sex is icky and funny and
Ew, it's
quirky.
Right.
And so I was a bit of a tomboy in class because I hadn't transitioned, but I was very obviously a raging queer. And everyone could pick that as soon as they saw me. And so the first sex ed lesson, they passed around condoms and other things. And all the girls were like, ew. Isabel, you take it. Oh my God. And I just stuck my hand in it and waved it around. And they were like, oh my God, Tadek, stop. Oh my God, it's so disgusting. I'm like, it's just it's a piece of plastic. You're not gonna die. I kept doing that the whole time. And it was eye-opening for me because Mum and I are quite open about sex and quite sex positive. And I hadn't really realized that everyone else kind of thought, I thought that was a thing people had on TV where they were kind of scared of sex.
Right.
Because being autistic, I still kind of miss several social cues. So I'll ask my friends about masturbation and forget that's not a thing you do. That happened in grade 8 and I was like, oh, right, whoops. And it's just it's weird for me that people are so scared of sex, and it's all linked back to their sex education where they didn't get any or it wasn't positive at all. It was
well, a lot of people report that when their science teacher or PE teacher had to do the sex talk, there was a deep discomfort, blushing, stuttering, mortification, and then the reaction of the students, which when they see that weakness, they go in there for, don't they? And they try and crack it open and destroy that teacher.
My class had a reputation of being a really nice angel girl class, and all the teachers loved them, except we were actually terrible and wanted to kill all our teachers. We had not me personally, I was I'm not gonna say I was fine, but I didn't have a vendetta against their existence.
Yeah.
Whereas as soon as half the girls in our class saw weakness at all, they were like, ooh, I see that, I'm gonna dig. And we had our PE teacher, this old 60-year-old man, soups awkward, and that's his whole personality was awkward. The girls hated him and they went for every little flaw they could find in our sex ed classes. So the moment he brought up queer people, and he obviously knew nothing, they were asking the worst questions you could think of. It was incredibly homophobic and transphobic, and I was just sitting there I am uncomfortable.
Right.
And he had no idea what to do at all. He's a PE teacher.
So Tadek, and I'm putting this to everybody else on the panel, what we'd like to see disability included in sex ed, the queer experience treated as not like a freak thing or a token thing, but actually unpacked. Do you think that we'll ever get to a point where we could talk about pleasure in sex ed? Can I start with you, Charlie?
I'm hoping that eventually we will, because it's something natural. It's a natural thing that happens. And it shouldn't be something that's such a taboo subject that it gets swept under the carpet and it's like, we're not going to talk about that because that's something that, like, that's disgusting. No, it's normal, it's natural. It should be something that is spoken about in just a natural setting because it's something that is very natural that happens. So, yeah, definitely.
Mia, what would you like to see included? I remember you saying about abortion, you didn't really learn about like how to access and what actually abortion involved.
Yeah, and so my family are very open about sex. Like, I never knew that sex was a taboo subject, and I knew family members who'd had abortions, but that was just, you know, a passing thing and, you know, kind of a joke, like, oh yeah, that time. But at school, we'd never learnt about the specifics of abortion. Like I said to you, it did come up actually a couple of weeks before I found out I was pregnant in class, in legal class. We were having a bit of a debate about whether abortion should be legal. And I, of course, strongly said yes, but there was a lot of people who said, no, oh no, you should never have an abortion. That's, you know, this and that and whatever. But, you know, where I come from, sex is just, really something that you don't talk about. Abortion, you don't talk about it. And there's a lot of stigma around and shaming, like, you know, the word slut. I got that thrown around all the time. From when I was in year 7 and year 8, I hadn't even kissed a boy yet, and some of the boys actually wrote in an alleyway in town, Mia Gallo is a slut. And I hadn't even kissed a boy yet. Like, so in terms of where I come from, I think it's going to be a really long time before we even get to talk about sex as a pleasurable experience for people. Yeah, and I think that the schools are particularly scared about doing that because then they'll be promoting sex, like, you know, promoting people to go have sex, which everybody is already doing mostly anyway. So,
Yeah, it's such a moral minefield.
Yeah.
Amal, you, with 6 kids and your own education from a different culture, what would you like to see taught? I think it's on.
It's on. Sorry, that the English is my second language. And the first time I come to in front of a lot of people like this. Doing very well. Yeah. And the question too.
So what would you like to see your children taught about sex?
In our country, we don't do sex until you get the marriage. And I tell my kids, but I tell him that's the rule in Australia, but in my country, when you go there, don't tell everyone we do the sex, we do the sex. They kill him. Yeah, in our country, that one is very bad thing. You do the sex when you get the marriage. And when we go there, I go last year with my daughter. She is 15 years, now is 16. And she engagement there. And she tell me, Mom, can I do sex with my... I tell her, what? you need the family kill you here. You have to do it, I don't know. And she said, why? In Australia, when you have your boyfriend, you have to do the sex. I tell her, this is Australia and this one is Sudan. It's big difference. In our culture, it's not. But here I tell my kids, you have to do it, but don't bring the baby.
Don't make a baby. I love it. Thank you, Amal.
My daddy said that you have to do it, but don't bring the baby.
I should have listened to that.
Kath, education for you, what would you like to see changed?
As I said, I went to a very good school in Melbourne, Methodist Ladies College. I think we got a banana with a condom. from
And
the
have you ever
science
had
teacher.
sex with a banana since then?
No, I haven't, but I have delivered a lot of talks in rural and regional Victoria about living with HIV and sexual health as part of the Positive Speakers Bureau, which is Living Positive Victoria and Positive Women. I have been to the school that Charlie went to, and that was very interesting. There was another school in Shepparton where there were a lot of Muslim students, where the girls came up to me and said, we're expected to do this, but we're expected to be virgins. And, you know, going into that knowing what I was facing, I spoke to their coordinator beforehand and I said, I'm just going to be brutally honest with them. They're here in Australia, this is what they're being asked to do. They're being exposed to pornography that shows anal sex, that is rough, is supposed to be what you do. Now, I'm telling girls, I've never had it. So no, that's just the porn and you've got access to that and that's what the boys expect. And no, it's about you, what you're comfortable with doing, how to access services without your parents knowing. You're of legal age, you can get a Medicare card, you can go to the sexual health centre. The biggest disappointment about doing all these things is down in Portland a few years ago I did do a talk, and whether those girls were in that class, within the next 2 years 2 girls were infected by someone, the same boy with HIV, and they're not even finished school yet. And did they not listen? Or were they not there? Or are they pressure from the boy, or drugs and other alcohol impaired, which we talk about in our talks. What I'm now starting to talk about is undetectable equals untransmittable. I've got a sex life again after 10 years, which is great. And I've actually now got a partner who pleasures me, which is great. So I am going to start talking about that at high schools, because we're being engaged to talk about what is healthy in a relationship, negotiated sex, around whether you're going to use condoms or not, and how to access sexual health centres so that you can ensure that if you make that choice, that you're, you're STI free. And have the talk around if someone strays out of the relationship, the respect of, and at 15, 16, this is hard work, but the respect for each other that say, oh, sorry, I stuffed up, we've got to go back to using condoms for a little while. So love yourself first in the education, respect yourself first, respect the relationship, and then if that person wants more, then they're not respecting you. So it comes down to respect in any sort of relationship.
And communication, and everything that you're saying is so true, but when you're trying to apply that to a 15 or 16-year-old, it's so much trickier. Yeah. Luckily, we have one right next to us here.
Yeah.
I actually wanted to talk to you, Tadek, about living rurally.
Yeah.
What are some of the positives about being from Ballarat?
Well, I really like the farms. So it's really just like, it's pretty community driven. So that was one of the reasons I was okay with moving up here from Melbourne, which does have quite a big queer community. So first moving up here, I was kind of like isolated till I found where the communities were actually hanging out. So like, sex is kind of treated the same at the high school I was previously at as the high school I am now, but it's still.
Did you sort of have a fresh start with your move?
Ooh, somewhat. So when I moved, I was in the process of transitioning, but like it kind of got mangled halfway. So ideally, when I moved, I wanted to transition term 4, grade 9, and be done with it. That did not happen, so I had to wear a dress and be a girl for the first term and a half I was in Ballarat, which was awful. Then after that, about term 2, grade 10, so last year, April, fully transitioned And school's pretty good with that apart from bathrooms, which I still have to use the disabled bathrooms, which I hate because I am disabled, but I'm not physically disabled, so I shouldn't be in there.
Yeah.
And so the policies on that were a bit iffy. They'd had 2 trans guys before me. So,
So they should have known a bit better.
yeah. But I've only been, it sounds bad to say I've only been like bullied a couple times, but it's better than the rest of the schools in Ballarat. Because I've got quite a few other trans autistic friends. We've got a little co-op, and they're at the public schools. They face like way worse. The funding is less. The counselling is less. They don't really care if a student gets bullied because it's not like a big deal to them. And some of the schools have actually actively transphobic school counsellors. Yeah, so there's a couple in Ballarat where the kids just don't go because they'll get called psychotic, and so they don't go to the school counsellors and they don't go to the teachers about anything.
Charlie, I can see you nodding vigorously. Does this mirror your experience?
So when I came out at 14, I was the only openly trans person that they knew who transitioned at the high school, and I had the exact same experience. So I was told, because at the time they had a boys uniform and a girls uniform, and now it is unisex, but when I was going, girl-boy uniform. And there's 2 experiences that I had. So the first one was when I first started transitioning. They said they didn't know what to do in the bathroom situation, and they told me, so you can use the teacher's bathroom or the disabled bathroom. And I was like, well, can I just use the boys' bathroom? And they're like, no, we don't think that's such a good idea. And I was like, okay. Then I just kind of was like, yep, all right, then whatever, I'll just use that. I didn't agree with it personally, but, you know, the head teachers and the principal were saying, you know, you have to do this. So that's just what I did. And then the second experience.
What were you afraid of, that you would see a penis?
Yeah, exactly. Like, oh God, he's seen a dick. Like, okay.
It seems so strange. Like that. Wouldn't the first thing to do be to say, what do you want to use, Charlie?
Exactly.
Well,
exactly.
For me at the time, I'd not been using male bathrooms, but more because I was at school 5 days a week. I didn't really go out like a ton, and so when I was in public, I just used whatever bathroom I felt safest in. So I didn't really have a frame of reference for which one I wanted to use, so I didn't push to use the guys' bathrooms. I would now, but I just can't be bothered. Our other problem is the disabled bathroom is also the teacher's bathroom, which I find problematic on several different levels. But at one point I got in trouble for using the bathroom I'd been forced to use.
Oh, man.
And I'd been having a really terrible day that day. It was the end of school, and I'd walked out and run into a teacher I was slightly afraid of, and she got me in trouble, and I burst into tears and started sobbing. And they had to send an email out like, yeah, this kid has to use these bathrooms. And like, I guess they put my face attached because now all the teachers know who I am, which is weird. I'm used to it though, but it's like still weird.
Sure. Sorry, Charlie. Can you continue?
Yeah, no. So the second experience I had was when I was wearing the male uniform. I'll wear quotations to that. And we had a substitute teacher for one of my classes, and I was wearing what was called an out-of-school uniform jumper, so that's a normal jumper. And so she asked me to take it off, and I took it off, and I was wearing the male uniform, and she turned around to me and she said, "You're supposed to be wearing the correct uniform." And I said, "What do you mean about wearing the correct uniform?" "I am." And she goes, "Wait." She goes, "Are you a girl or you're a boy?"
In front of?
In front of the entire classroom. And I had about 4 friends sitting beside me, so 2 here, 2 there, and I looked across at them and their faces just went, "What the fuck?" And they're like, their mouths just dropped. And at that point I was like, do I start crying? Do I scream at her? And I got up and I was like, I am wearing the correct uniform. And she was like, I don't know about that. And I was like, okay, because I called her some very choice words and left the room, grabbed my bag and left the room and started to leave the school. And she's obviously called the vice principal in the meantime and said, he's just swore at me. Didn't explain what she had said. She just said, oh, this kid's just swore at me. He's called me, an F and B, and left the room. And So he's come running after me and told me, like, started yelling at me, how dare I call a teacher that? And I started yelling back at him, how dare she ask me what my gender is? Like, how dare she, you know, put me in front of the whole entire class and ask me what my gender is. Are you a girl or are you a boy? And he was like, oh. So she hadn't told him, and she was like, he was like, I didn't realise that she'd done that. And I was like, yeah, well, maybe you need to educate your teachers a little bit more about trans issues and how that question is so degrading to young kids. And he was like, oh, okay then. And I was like, yeah, I'm leaving now, and just left the school and called my mum and picked me up, and my parents were furious. Like, my mum, she was the angriest I've ever been. She's like, that is disgusting. And I was like, yeah, I know, tell me about it. Like, I lived that experience.
And I'm guessing that in some of your interactions in the health sphere, things like that happen because of ignorance. Mm-hmm. That's changing though.
Yeah, it's changing dramatically. So the doctor that I have now, he is absolutely amazing. So he checks my bloods, he does my hormone levels so I get injected with testosterone every 3 months. There we go. Every 3 months I get a testosterone injection, and he takes care of that. He does all my blood work. He does everything to make sure that my hormone levels are where they're supposed to be. So yeah, no, it's amazing. And I didn't really expect to have a doctor like that in such a rural setting, but you know, he's been amazing. So it's improving drastically.
I've got to switch sides again. My eyesight's not good enough to span the length of the stage. Mia, I wanted to talk to you about your experience with pregnancy. So you were 16 when you got pregnant.
Yep.
I know Mia's mum, by the way, and she was like the groovy mum. She was the one who was sex positive, who would take the kids to get birth control knowing that they were sexually active. So you weren't in a situation where heads were being buried in sand, but that was the sort of the course of action that you took when you were feeling like, oh God, it feels like there's kicking in my womb.
Yeah.
Perhaps I could be pregnant. So tell us what happened when you finally decided to confront this potential pregnancy.
Yeah, so I was definitely in denial about being pregnant because, well, I was school captain. So I was in year 12. I was ready to take on the school year. I just got DACS the year before. So, you know, things were going really well. So yeah, no, when I found out, you know, confirmed pregnancy, straight away I knew that I wanted to have an abortion. I wanted to get rid of the baby. I just felt disgusting knowing that there was something inside of me, because I was never interested in children. I really didn't want to have children. But immediately, you know, I said to Mum, I don't want to go anywhere here. To see the doctor, like, you know, what can we do? And Mum said, well, how about we just drive straight down to Melbourne on the Monday, because it was Saturday night when we found out. So it really, it was hard having to wait that whole Sunday. Well, we might have drove down Sunday night 5 years ago now, so it's a bit, you know. But the first thing we did was we went to the Royal Women's there, to the counselling department, to kind of get the ball rolling, I suppose you would say. And they were really good there. They sat myself down, Nathan down, and Mum down to make sure that it was entirely my decision to have the abortion. But then they said, you know, unfortunately you do need to go away and get a referral to come back in. So luckily we had family to stay with in Melbourne. So we were thinking, okay, that sucks, but because we were really hoping to just, you know, get in that day and just get it all sorted out. So we went away that day feeling, although, you know, I felt really upset about the whole situation, just that support that we got from her, and her, you know, kind of being like, you know, this is okay, this happens, all of that made me feel a bit better, and like, oh, you know, this is going to go away really soon. So anyway, she called back and said, don't worry about the referral, we can get you in tomorrow to see an obstetrician and an ultrasound. Like, we've kind of put you in between appointments, so I've got it all sorted out. So I'm thinking, oh, thank goodness, tomorrow we'll be able to find out when I can get rid of this baby. And I went to the obstetrician, and that was really a great experience. Went to the ultrasound, not so great, didn't look at the ultrasound, didn't want to see the baby. And, you know, that was the first time that I really just broke down and started to cry, because I was thinking, oh my goodness. I could kind of tell by the way that she was speaking that the baby was looking a bit further along than what you know. I didn't know about the timeframes of abortion, which is, you know, one of the reasons why I kept going, oh, could I be pregnant? Oh no, don't worry about it, deal with it. Like another day, no, you're not pregnant, because I'm thinking you just take a pill and the baby just goes away. Like that's all I knew. So unfortunately, when it came time after the ultrasound, I got sat down with the counsellor, the obstetrician and the head of the department there, and yeah, they told me that I was 24 weeks and there was nothing that I could do about my pregnancy. Obviously they said I can, you know, put the baby up for adoption if I wanted to, but they said there's nothing else that we can do, and yeah, it was pretty emotional. So
I bet. So you were sort of condemned to be pregnant.
yes, literally, that's exactly how it felt. But because of the support that they gave me, about, you know, 5 to 10 minutes later, Nathan and I were laughing about it and thinking like, okay, this sucks, but we might be okay, this is going to be okay. And, you know, Mum had kind of come around to it. Nathan's parents were quite happy on the phone when we said, you know, the abortion's not going ahead, whatever, but we're like, oh, we're happy. But then coming back to Swan Hill and the interactions that I started to have with the health professionals there really reverted me back to that initial fear, shame, embarrassment, and really not feeling comfortable in myself as a pregnant person or a mum.
Can you explain what those interactions were?
Yeah, so one of the first things that happened was we made an appointment with the doctor I'd seen about the contraception. So we went in there and sat down and said, I'm pregnant, blah, blah, blah. And she said, oh, well, I don't deal with babies, so you'll have to see someone else. So, yeah, so we were like, oh, okay, keeping in mind in Swan Hill, I mean, I don't know what it's like in Melbourne, you don't actually get an appointment, you don't ring up and get an appointment that day. You quite often have to wait a couple of days or a week or a couple of weeks. So we're thinking, oh, okay then. She didn't tell us what doctor she would recommend, so we went up to the front counter and had to explain to the people there, can we see a doctor that deals with pregnancy? So we went to this doctor who, again, was really uncomfortable with the whole situation. She wasn't unkind, but it was very awkward and, yeah, it wasn't, you know, the nice appointment that you'd probably want, you know.
Yeah.
So I explained to her and Mum that we really wanted to have the ultrasound again because I hadn't looked at the baby and I really felt like I needed that. So she said, yeah, I completely understand, that's fine. I'll get you the ultrasound slip drawn up. Great, booked in for that. On the day I got there, Mum had taken time off work, and mind you, she is a pretty busy lady, so it's not easy to get time off. Nathan's mum had taken time off as well, and Nathan himself, because we all, you know, wanted to look at the baby together. And then we're sitting in the waiting room and somebody comes out and calls my name and I'm thinking, oh, yay, I'm going to see my baby. And she says, yep, so we've got your referral here, but we can't give you your ultrasound. And I said, oh, what do you mean? And she says to me, well, we can't just go giving ultrasounds whenever you feel like it. Like perhaps maybe you should go to Mildura and pay to get one of those 3D ultrasounds. And I said, but you've got the referral. And I explained the situation to her. And she kind of said, tough luck. And, you know, while she was speaking to me, so, you know, this is the waiting room and there's a window there and the other workers in the radiology department were kind of standing behind that. Mind you, I knew all of them. They were just standing behind that, just looking at me like that. So I'm thinking, oh, great, we're off to a flying start.
Yeah. That's a situation very unique to living rurally, is when you're like, I just want to get my thrush cream. I don't want to have a conversation with my neighbour's daughter who works at the chemist, you know, and it's super embarrassing. And I did want to point that out to the room because I know you all work in health.
Yeah.
You've seen heaps of vaginas. A lot of us have only seen our own. Okay, we feel shy about talking about it. We feel shy about showing other people. So when we go to a situation to get an ultrasound and people like know us and judge us, it can be it can be quite crushing in a way that you might be as practitioners a little desensitized too. So I just wanted to make sure people could see that. It was so painful being gossiped about, I imagine.
Yeah, it was. And that was why we went to Melbourne in the first place, because number one, we didn't know about abortions in Swan Hill, but there was so many concerns about confidentiality. I knew everyone at the medical clinic, at the pharmacy, at the hospital. So we knew if we went to those places, people would find out, it would spread like wildfire, not flower. But also, I anticipated that treatment, and then so it was really, really upsetting to get that treatment and know that I would have to deal with that throughout my whole pregnancy, the birth and thereafter as well. And it definitely, not every single person I saw was like that. My GP, I ended up finding a really, really good male GP. He was absolutely amazing. Didn't treat me like a young teenage didn't treat me like, someone to feel sorry for. He just treated me like an adult. But basically everyone else I saw, it was just.
Amal, advocacy is something that we want to talk about. In your hometown, Shepparton, there are quite a lot of Sudanese people now. And I imagine because you arrived 14 years ago, you might support newer arrivals to Australia, help them navigate the health system and understand their rights, understand how it works here. When you first got here, Amal, did you have somebody to help you?
No.
You're in a unique situation. English is not your first language. So when you see, say, a nurse or a doctor, do you have somebody to help communicate?
We have an interpreter Arabic.
Yeah.
Yeah.
So there's an interpreter, you have to set that up in advance. You have to have a few weeks warning.
Yeah.
Yeah. And with people who are new to Australia, do they understand how it works?
No. They know.
So it brings up this idea of advocacy, which I see I'm sure everybody sees it in so many health situations. I want to put it to all of you. Did you have an invaluable advocate? I know, Kath, for instance, you're your greatest advocate in your pursuit of fair treatment, medication. What's your read of advocacy?
It's exhausting. It's exhausting. When I first entered HIV care, coming from Methodist Ladies College, where I was taught I was equal, I just went to any service. I'm like, oh yeah, well this is an HIV doctor. And I would be sitting in a waiting room with gay men, and I don't want to be judgmental in any way, but the demographic of HIV is 90% of people living with HIV in Australia are gay men, or it's about 85% now, because they're receiving all this lovely care and messaging and their diagnosis rates are coming down. Meanwhile, heterosexual women and men who identify as straight but are actually bisexual aren't receiving this messaging. So I'm in a setting where traditionally it's gay men. And I actually had one guy look me up and down and say to me, "What are you doing here?" And I'm thinking, what the? And he said, "Women like you ripping funding away from us." And I've just gone, right, that's it. That's it. And that set me on it. Okay, I need a female doctor in a pleasant setting. So I got a female doctor who was a GP, who was an S100 prescriber, which are the drugs we take. Now, they aren't technically specialists as far as the Victorian state government is concerned. And at this stage, I'm travelling from Mount Beauty down to Melbourne, which is a 5.5-hour drive. There's no public transport. It's a 300 kilometre or 700 kilometre return trip. So having to find somewhere to stay. I'm not working at this stage because I've had a nervous breakdown because I've been put on medication and not told to take a vitamin D tablet, and that affected my mental health, and I went into so many things just snowballed, and I just said, right, I need to have control of this. So the advocacy is ongoing and I like to see myself as a trailblazer. I've actually been pushing for telehealth for myself for 8 years since Julia Gillard introduced the program, and I've only just got it. And I know how to navigate the HIV, the health system. I've got, when Jill Hennessy was the state health minister, I had her chief of staff's mobile number, and I would ring him and say, this isn't good enough. You know, I pushed and pushed and pushed and pushed for so many things to happen. They're finally happening. So S100 prescribers who are GPs are now, you can now get reimbursed for travel, but they haven't allocated any funding to it. So that's the next thing. I've got to now go to Daniel Andrews and say, where's your funding for it? Because it's not just HIV doctors, it's diabetes doctors that they've included in it, and other chronic illnesses that we're seeing. So if you're travelling in excess, and we're only talking 100 kilometres. So if I wanted to go and see someone in Albury, well, Albury-Wodonga, there's another problem because it's a border town, and you've got a state government here and a state government here, and one takes responsibility for the health services on that side of the border if it's regards to this, and it's like, oh my God, this is just a minefield. So you've got to know your rights.
One of the things that you did, Kath, was you helped organise community pharmacy dispensing. So your town has got a population of 2,500. It's very small, but you've organised it so that, I guess, niche or very rarely used drugs can come through the city to your local pharmacy where you can access it.
It was a federal government initiative to have S100. So we're talking about not only people who have HIV, but people who don't want to contract it. PrEP, or pre-exposure prophylaxis, is an S100 drug. It's one of the drugs we take that are available to people living with HIV. So they saw it that if people didn't have to travel in excess or go to a hospital or a sexual health centre, or, you know, travel a lot, that they would access it. But the uptake has been so little. So I got to actually speak in front of the pharmacists before it went national, and I think it was the 1st of July a few years ago. And I, 2 months beforehand, went to my pharmacist and I'm like, guess what, you know, because I'm openly living with it. I openly live with it in my community. I have been openly living with it since the day I was diagnosed because I don't want another woman going through this. And I'm like, yeah. So what I did was I said to them, I'm giving you enough lead time to find out how to get the medications, because different medications come from Sigma, or they come from, you know, if you've worked connected into pharmacy, you know that. So it took him a while to work, or the pharmacy, to work out where it was going to come from, and occasionally they can't get it from there, and all that sort of stuff. But it was good to be able to just give them my script, and 2 days later I've got 4 months worth of medication and I don't have to worry about it.
So I think what I've learnt from Kath's experience is that she's got to advocate for herself, and often trailblaze with the people in her community to explain to the pharmacist how it works, to kind of backfill then his or her knowledge, and then perhaps spread that information. All of this is contingent on her being willing to disclose to the community at large that she's HIV positive. If she were in a situation where her privacy around that was more guarded, it would be a different situation.
People travelling to bigger towns to access a chemist warehouse or whatever, but you can't just walk in with an S100 prescription. You know, you can in big pharmacies, so in the centralised areas, which, you know, every person in living with HIV, regardless of where they are in their care, has the right to live wherever they want without barriers in place to them accessing treatment, and whether that be a GP that goes, what? Or someone who denigrates you because of your choice to actually live openly with something to help reduce stigma. It's just, you know.
I think with everybody on this panel today has experienced a situation with their care where they've had to travel, often at great expense, to the city. Charlie, a couple of things. Your advocate in the early years was a social worker called Anna. Can you just quickly tell us what she did for you?
Yeah, so my social worker, so there's a program run in Shepparton called Diversity, and it's run by Uniting, and it was once upon a time run by Damien Stevens, and now it's run by Georgina Port, and both are just lovely, and I've known them for 12-ish years, so they're amazing people. And Anna, she works out of the Diversity Project for Uniting, and she was my very first point of contact, being like, all right, I need to access medical services, I need to start medically transitioning, how do I do that? And she took me down to my gender psychiatrist in Melbourne, because there's still no gender psychiatrist in Shepparton, so you have to travel down to Melbourne. So she took me to my gender psychiatrist. She was able to get funding to pay for some train trips, train trips. So yeah, she was absolutely amazing, and I haven't seen her in about 6 months, because she now kind of works out of Headspace, but she is a social worker for my younger sister, so she has worked within our family, so she's
She
just
sounds like a
amazing.
legend.
She's an
Can you
amazing
also
person.
explain to us about teleconferencing and how that's worked? Is it with your gender psychiatrist or with your your endocrinologist?
Yeah, so like I said, there's no endocrinologist or gender psychiatrist that I know of that works out of Shepparton. It's all based in for hormonally, so it's all Melbourne based. So it's just referral after referral after referral. So to be able to legally transition medically, you have to have, I think it was about 6 sessions with a psychiatrist for them to be able to deem you mentally stable and competent enough to be able to access hormone injections. I'm not quite sure if the process has changed now, but
It's the
No,
same.
it's the same?
I just had one like last week.
yeah.
Fun.
Well, there we go. So there we go. Yeah. So, and do you know, I don't know if the laws changed, but do you know if you've got to be 18 now to legally, or you can be...
No, I'm starting my hormones hopefully like January-ish next year.
Yeah.
So I've had about 4 or 5 of my mental health appointments, and I've just had my blood test last week. So once that's gone through, I can start seeing my endo in December.
Yeah.
But yeah.
We are going to go to questions soon, but as a final roundtable question for everybody on the panel today, I would like to put it to you, maybe Tadak, because you're furthest away. What can we learn from your lived experience that perhaps we could do differently next time?
Can you get back to me on that?
Yeah, we'll come back at the end. Kath, what about
Give me
you?
a sec.
When I ask for something, there's a good reason I'm asking for it.
Yeah.
My mental health has always been poor as well, and just as a scenario, I've had to use the HIV ticket to get a psychiatrist. I haven't had one for a long time, or since 2012, and I found that I needed one, and it took me 7 months to get one, and I had to use my HIV specialist getting in touch with the psychiatrist at the ID clinic, would he take me? And then I'm like, right, now I've got to travel to Melbourne again. When I first met him, I said to him, I want telehealth. He said, no. I said, don't discount it. I said, Edwina, who's my specialist, and I currently speak on the mobile. I said, so we have an hour's appointment on the mobile, we go through what we want to do, she sends me my script, my pathology request, any referrals that I want. So after 3 visits with him, he said, yeah, I'm happy to do telehealth. I'm like, cool, let's go to the ID clinic coordinator. Oh, we've never done that before. I said, yeah, but you're the Alfred Hospital. What do you mean you haven't done it before? So I actually had to go through the telehealth coordinator, get them to organise it. And so I think you've got to be prepared to advocate for yourself. I've just been through some significant stuff with my parents' health, and in the end, I'm in there with my mother's surgeon going, what have you done? Dad thinks Mum's losing the plot because you've got her on Lyrica and she's nuts, but she's not. You need to explain to him that she needs to go through the double knee replacement pain on the drugs, and she's not insane. So you've got to always be advocating for yourself.
So
and not just
what
take
you're
it.
saying is when you're advocating and asking for what you want, you need to be able to hopefully speak as much lingo as you can. Does that help?
Lingo and beliefs. Like I actually said to my psychiatrist, I'm still on the contraceptive pill because HIV can trigger early menopause. I'm 47, there's still an opportunity. So whilst I'm on the pill, I'm not getting into perimenopause. He said, how do you know? And I said, well, it's hormone replacement therapy on the pill. So it's keeping me at a point where the body is, I don't want to get pregnant. And and he's like, oh. I said, just have a think about it. He said, where'd you get that advice from? Where'd you get that advice from? And I said, well, number one, I'm a woman. I've been on the pill since I was 14. I'm still having my periods. It helps control my hormones, which works with my depression. So I think I know because it's me, it's my body, and plus my GP, who's got gyno experience, is saying the same thing. So let's just go with that, and we'll stay on it.
So trust yourself is the
Well,
message.
don't accept the word no.
Okay.
Don't accept no unless they're prepared to back it up with all this evidence to the contrary. Like abstinence means you don't get pregnant? I don't think so. Because where does abstinence, Anyway, you've got to be prepared to get your practitioners in whatever scenario to think outside of the square of this is how I treat someone and this is how I treat Catherine, because Catherine is a person who's been living with it for 11 years, knows her shit and knows how to advocate for herself. So, yeah, let's listen to what she has to say.
Amal, I did want to get to just quickly an experience that you do talk about because of your history of FGM. Getting your period is different for you. Do you mind just explaining how it's different?
Okay. My FGM is, I don't know how it look like, because when we done for me and then he put smudge, matching.
Yeah, like a brand or a burn?
Yeah, the wood one.
Yeah.
To make the size for the hole.
Yeah.
That I'm not married at that time until my period is not coming all of them outside, and they make me sick when I'm married and I do the 6 and I open.
Yeah.
And they coming little bit 3 days and then stop. When I get the first baby and that I coming normal, they coming, but the problem is they close it again. They do it again, and the second child the same, the third child the same. But here in Australia is no. The first child in Australia they cut me, and then stop.
So your periods have been improved?
Yeah, it's coming now. It's normal one.
Sure. Just something to bear in mind if you are treating people who may have experienced FGM is that the periods can be absolutely debilitating. Mia, just as a sort of a wrap-up question, what can we learn from your lived experience?
Yeah, so definitely a few things. I'll try not to miss anything. But my experience could have definitely been changed if, you know, the way that sexual education was approached at school was a lot different. You know, going back to what everyone else kind of said before, like there really needs to be a more holistic approach to sex education. Obviously all the information's there, but unfortunately the schools, you know, so what happens is just you get people from health promotion, they come down and they do a talk, which is great, but you know, you're all sitting on the floor, you're not listening. What would be more beneficial, and I've spoke to a lot of young people about this, is they want to go to the services themselves. They want to have sex education from sexual health professionals. They have lots of questions that they want answered that they're just not getting at school. It's very anatomical at school and there's no real life application either. So, you know, it's great to say this is what a penis looks like, this is what a vagina looks like, this goes in here, but anything beyond that, you know, don't have sex because you'll get pregnant. Well, what happens when you get pregnant? Like, young people need to know about the choices and, you know, going back again to the time frames as well with the abortions, like they need more knowledge about all of that. So, yeah.
One of the things you said in your essay was it'd be great if kids could get escorted or sent on an excursion to the health clinic to walk through those doors and look around and kind of feel familiar with the place.
Yeah, definitely, you know, because it's really scary going into medical clinics for a lot of young people. So if they were able to, you know, go in there, not in classes, like in small groups, I'm not sure how it looks, but, you know, and they get to know the people that work there and the services that are available. I didn't know what was available at health promotion until I've done a bit of work recently out in the community. And so, yeah, it's really sad that the services are there, but people aren't accessing them.
Yeah, totally. And I think it's really important to remember that education we get at school often is the only education that we get. There's a fantasy that our parents are really woke and will talk us through all this stuff, but my own experience, where my dad was a pharmacist and really should have been able to be quite fluent with this stuff, was not. And my mum was from a different cultural background where she found it excruciating to talk about. Charlie, what can we learn from your lived experience?
I think the thing that I cannot stress enough is trans-inclusive language. So, you know, even when, like, you know, you're doing, especially, you know, sex ed, this is a male, this is a female, this is what you should look like, this is what... No, that's not right for everybody. That's not, you know... One thing that I've learned throughout, you know, my years as being openly transgender and advocating for transgender people is that your genitals don't equal your gender. So that is the main thing that I cannot stress enough. I've had, I did a panel a few years ago, it was out of Shepparton, and it was kind of the same, so it had health professionals, and we got to the question time and one doctor asked me, what do you mean by trans-inclusive language? Well, when you're speaking about females and males' genitalia, it's not the way that some people are. So this is not what a female is, this is not what a male is, and even intersex language as well. So, yeah, and just even, you know, asking the simple question, what are your pronouns? Yeah. So, yeah, exactly. So, pronouns. My pronouns and pronouns are right here. And then, so you're just asking what are your pronouns, not are you a boy, are you a girl? Simple pronouns. I mean, there's a whole heap of pronouns that people identify with. So I identify with he and they pronouns. So identify with a he pronoun and identify with they, because I feel like sometimes I'm a bit out of the binary. So, you know, you've got male, female, and in the middle there's kind of this out there. So I don't feel, some days I feel like I do not belong in either a male or female category. I feel like I'm in between. So, and yeah, just just more inclusive, just being more inclusive and respectful. And nice, exactly. Just be fucking respectful. Like,
Respectful relationship.
exactly. Everyone comes from a different path, and we all need to understand that not everybody shares the exact same story. We all have a different story. We've all grown up in different parts, different walks of life, and just be acceptful of people, and respectful. I cannot stress that enough. Yeah.
Adak, did you? What can we learn from your lived
I'll
experience?
be really quick. My personal pet peeve is when people use he or she rather than just they, because they can be a
Okay.
singular pronoun, and it's really easy. And I know it really upsets some of my non-binary friends when they have to go in and doctors automatically say like he or she rather than they. Also, just listen to your patients when they say like I want to do this. I have a really good GP, so when I talked about getting an autism diagnosis and getting a referral to the gender clinic, he just did it like automatically. He's really, really chill. But I know there's other people who've had to slog through like 20 different appointments till they'd even get a referral.
Yeah.
And if you say like you won't give someone a service, like you won't, I don't know, check their blood or whatever, be prepared for them to make you do it anyway. And like I know people who are disabled and have chronic pain, and their doctors won't give them the test. And what they do is they tell the doctors to run the test anyway and write on the sheet that they initially refused to give the test, and then they get the results back, and they're usually positive for whatever the patient originally thought. So I've got chronic pain. I've had like the same problems. And yeah, just be respectful.
Okay, we're going to put it to you now. Has anybody got a question that they'd like to ask the panel? We'd love to hear from you.
I wanted to first of all say thank you to everyone on the panel for incredible courage. And I also wanted to say thank you, Yumi, for Ladies We've Got to Talk, because that for me and all of my friends has been such an empowering podcast to listen to. And it's made me, I've from an education background moved into health promotion space, and really for me it's so brilliant in the way it smashes taboos and really gets us talking very openly and honestly about things that have been, really not talked about openly. But I wanted to sort of get I'm hearing really loud and clear around the shortcomings of education and where we need to sort of aim for in that space. And it was really interesting looking at statistics around the National Survey for Secondary School Students. And then when you're looking at where young people are getting their information, which is first port of call was, internet. And then where are their trusted people, in asking for support in that as well. And I'd love to hear your thoughts, Yumi, around the power of use of podcasts and online resources, particularly for rural communities, in being able to access information and connect to local services and understand what's there in their local region, but also around that smashing of taboos.
Sure. I was thinking to talk to the room about podcasting and how powerful it can be. Could I see a show of hands of how many people actually listen to a podcast and know how to do it? So there's a few here who don't really listen to podcasts and don't know. It's basically like a really great radio show that you choose. Download it and then listen to in your own time, so you don't have to wait for it to come on. The beauty of podcasting is it's super cheap to do. The ABC one that we do has very high production values and it does cost money. But if you wanted to put together something yourself to just speak, for instance, to regional nurses, that you could do seriously for like $50. Basically, you can record broadcast quality on your telephone and use basic laptop software to edit it and then upload for free to iTunes. The trick is finding your audience, but if your audience is super niche, maybe they'll be able to find you. One of the tricks with our podcast is that we're very rigorous with the science. There would be no greater embarrassment to our team to be found to be making an error with the science. And for that reason, I think it is so trusted because we absolutely check everything multiple times. Podcasting, I think it is a great frontier of communication where everyone can have a go. And if your audience is 10 people, it's really good quality 10 people. hopefully. Does that answer your question?
Yeah, and have you got data around the demographics that are listening to your program?
So with metrics and podcasting, it is captured very, very accurately, and the turnover of that data is quick. So it's beautiful. You absolutely know if you've got a blockbuster episode or not within a day or two. They talk about the tail off of podcasting. So podcasting just lives and lives. So it could be 5 years' time, for some reason someone talks about you on a different podcast and there's a spike in your numbers after 5 years. I don't know the answer to your question about whether young people are listening. I did an event in Brisbane a week ago at the Powerhouse, and we met lots of people from 19 to 25 who listened to the podcast, and as a result have done quite emphatic healthcare actions, like getting IUDs put in because of what they heard. Like a group of girlfriends have been taking it in turns to go and get their birth control sorted because of the podcast. So there's definitely young, I don't know if you mean teenage, but young women listening with actual outcomes to do with their health.
You stood up and you talked about, obviously, education of people about sexual health. I think GP education is very important too. So I'm about to take part in another panel on Thursday, Melbourne Uni again, down in Melbourne at the Melbourne campus, GPs in training with my specialist, me, and someone else about U equals U, untransmittable. So finding a way, maybe through podcasts, to get out the most recent information about what's happening in the transgender. So you go in and you say, okay, I want to transition. Okay, well, I know you need six psychiatry sessions. You can actually go, the closest is here. We can assist you with travel through VIPTAS, all that sort of stuff. Like having all that information, because 10 years ago, getting an HIV diagnosis, it's like you walk out the door and you just go, where do I go? So having GPs know exactly where the channels are to refer people and putting them on the path that they're not having to do this advocacy for themselves would be wonderful.
Could I just thank our panel one last time, Tadak, Kat, Amal, Mia and Charlie, and my name's Yumi Stein. Thank you for having us. Thank you so much.